I am Dr. 𝐬𝐫𝐬𝐬 𝐬𝐫𝐬𝐬, orthopedics, joint replacement and sports injury specialist. Tomorrow is National Sports Day, which is being celebrated in the memory of Major 𝐘𝐮𝐯𝐲𝐻𝐼. Major 𝐘𝐮𝐯𝐲𝐻𝐼, who was our legendary hockey player. Even the sports person or every person of the world and the country, India particularly, they call him as the man with the golden stick, because the play he has shown in his time was amazing and wonderful. Like, he has brought 3 gold medals in 1928, 1932 and 1936. For the respect of him, the government of India has announced this National Sports Day in his memory of birth anniversary of Major 𝐘𝐮𝐯𝐲𝐻𝐼. And as far as the sports is concerned, like, I am presently in Faridabad, Haryana, where Haryana has contributed a lot in sports injury in recent time in Tokyo Olympics, where we have seen the Haryana, as per the population, it is just 2% of the Indian population. But if we talk about the contribution in the sports, Haryana has contributed almost more than 30-40%. The maximum players in the Tokyo Olympics were from the Haryana, and we've seen that many persons, even the gold medal which the Neeraj Chopra has brought, he's the guy from the Haryana itself. So on this National Sports Day, we appeal with every person or whosoever in the sports fraternity or not should play some sports. And this sports makes you unite with yourself, with the family, with the community and the country. And we know very well, even when the two countries are enemy to each other, they play sports, and with that sports, even the country remains united. If you talk about ourselves, like being orthopedic surgeon, joint replacement surgeon and sports injury specialist, today I would like to share one very, very important thing, that like there is different helpline number, like police number, ambulance number, fire number, child helpline number, women's helpline number. So for the sports person of Faridabad, Haryana, even in long term for India, we have launched this 𝐘𝐿 hospital has launched 𝐘𝐿 sports injury helpline number. This 𝐘𝐿 sports injury helpline number is 9354001099. So again, 9354001099. This number is for all the sports person or any person who can concern on this number for free consultation. If anyone has any problem related to sports, it will be picked by the particularly sports injury specialist, and the answer will be given to them. Maybe first aid, maybe a small advice can bring major change in his sporting career. So any person who has got any sort of injury, they can call 24/7 this helpline number, and he or she will get certainly the help which can make change in his or her life. So and the purpose of this number is that nobody has ever thought of this sports injury helpline number, because as we are living in Faridabad and Haryana, I can say the sports capital of sports state of the country, where we have launched this number, and this will be help to many sports persons who are not aware that in such a situation of injury where they should go or how to tackle all these problems. If something like this happens, everybody got panicked gets pain, panic, where to call, to whom to call, to which doctor to go. So if you get the first consultation in the right way, then certainly this will help that sports person. And the proper guidance, proper timing, including right from the injury management, prevention, and finally the rehabilitation will make his or her life as or before injury he or she was. So I would say that I would like to conclude today that everyone, even before or after the age of 40 or younger or even later, they should adopt some sort of sports. Whatever you do, you should take out time and you must play sports, encourage people to keep on playing sports. You must encourage your child, your kids to adopt sports as their one of the important career. We have seen in this Tokyo Olympics that May has done wonderful job of the combination of the sports and the study. There are some persons who have done extremely well in their academic career as well as the sports. So even some of the persons who are good enough, they can balance both together. Otherwise, if they are interested in playing, they should dedicate him or herself for the sports, so that our nation can bring more and more medals to the country. We should not be satisfied with just one gold. It should be more and more. So I again appeal with everyone that everyone should play sports. Encourage the people among yourself to play sports and play and let everybody play. Thank you very much.
So we have some questions on this live, and the first question is from Ms. Muskan Singh, and the question is, please share some tips to prevent sports injury.
Yeah, right. So sports injury is a very vague term. There are many types of sports like cricket, football, badminton, tennis, many things, athletics, swimming. So if you talk about the general thing, so for any sports injury, the upper level of that is the fitness for any sports. Even the shooting, which seems that okay, just we are having gun and then shooting. It's not like that. It's the mental balance, which is very, very important. So physically and mentally, from both point of view, you have to be strong enough. If we talk about the prevention of sports injury, for any sports injury, you must be fit enough before that. So fitness is very important. So fitness comes before that. Like we see the cricket team, which was earlier and now we see how the fitness has got the value all over the world. So if you want to be, don't be easily injured, then you should be fit enough. And for fit enough, you should do proper exercise, warm up, stretching, everything before any sports. If you do proper stretching, proper warm up, proper exercise, then most of the injury will be prevented.
Sir, Mr. Sandeep has asked if we can play at the age of 50 or 50 plus.
50?
Yes.
Of course, very nice question which I love to answer is that there is no bar to play sports. At any age you can play, and we have seen number of people all around the world who has played sports. If you talk about the age of the 50, they can play sports very well, no problem. But the point is which type of sports. Like if his legs, knees are okay, they can even opt for the cricket, maybe badminton or something like that. So there are different types of sports you can keep on playing. So it's not that this age bars you from playing sports. Rather, at the age of 50, you can play sports. That's not a problem at all.
Sir, another question is from Mr. Surinder Singh, and he's saying that 1 year ago he had a hairline fracture in his left knee. So, and now whenever he runs or he play cricket, it's very painful for him.
Yes, right. So hairline fracture in the knee area. So first we would like to know where the fracture was, what was the X-ray finding at that time, or rather the hairline fracture was the only culprit, or maybe some associated ligament injury, meniscus injury was there, because knee is very prone for all these sorts of injury. So we must evaluate patient, we must see him clinically, get the X-ray done, get the MRI done, and then proper conclusion can be made from that.
Okay, sir, there is another question from Mr. Ravi, and he's asking for some helpful tips for reducing tennis elbow pain.
Reducing tennis elbow pain.
Yes.
So tennis elbow, we call it tennis elbow because initially it came from a person who was playing tennis, but exactly it's not always true. Exactly, it's not always true. So any type of sports, or even the person who is doing lots of computer related work, can have this sort of tennis elbow. If there is tennis elbow, then he should do some sorts of physiotherapy, some exercises, anti-inflammatory, and some supporting medicine, and some restriction like lifting of heavy weight till it becomes properly alright.
Okay, so there is another question from Mr. Vishu Singh, and he is asking about, can you please guide him about hot and cold compression?
Yes, very right question. This is a very, very important question. Most of the sports
Sir,
person, even the...
and there is one comment which is saying, please in Hindi. Can you please speak in Hindi?
Fine.
Yes, sir.
So, अगर ये मैं बात करूँ, लोग पूछते हैं गर्म की सिकाई करें कि ठंडे की सिकाई करें, हॉट और कोल्ड. इन दैट सिचुएशन, इफ देयर इज एनी एक्यूट इंजुरी, अभी चोट लगी है, खेल रहे थे, गिर गए हैं, अभी कोई प्रॉब्लम हुआ है, फुटबॉल खेल रहे हैं, चोट लग गई है, समथिंग लाइक दैट, इन दैट सिचुएशन वी मस्ट यूज आइस पैक्स. ठंडे की सिकाई करनी चाहिए. तो कहने का मतलब ये है कि शुरू में जब चोट लगी है तो ठंडे की सिकाई करनी चाहिए, आइस पैक्स करनी चाहिए. जब आपका प्रॉब्लम क्रोनिक हो गया है, 10 दिन 15 दिन पार हो गया है, एक्यूट फेज खत्म हो चुका है, इंफ्लामेटरी फेज खत्म हो चुका है, इन दैट सिचुएशन हॉट फर्मेंटेशन कैन बी डन.
Okay, and sir, there is one more question from Mr. What's his name? Ravi Besh, and okay, he has asked the same question. Another question is from Mr. Deepak. He's saying that his wife is having arthritis and she often complain about pain in back and knee. What is to be done, sir?
So the age is very important. I would like to know the age if possible.
29 years.
29.
Yes.
So at the age of 29, if some person is having back pain, knee pain, then we have to see that in most of the cases this is posture related. So आपकी ये posture related, आपकी daily की जो एक्टिविटी है उसके रिलेटेड 90% केसेस में ये जो बैक पेन है ये मोस्टली आपके पोस्चर रिलेटेड होता है. सो ऐसे सिचुएशन में पेशेंट को अपना पोस्चर ठीक रखना चाहिए, डाइट ठीक रखना चाहिए, एक्सरसाइज रेगुलर करना चाहिए. अगर प्रॉब्लम ऐसा है कि कमर का दर्द है और पैरों में जा रहा है तो ऐसी स्थिति में प्रॉपर एक्सरे एमआरआई करके डॉक्टर को कंसल्ट करना चाहिए.
And so there is one question from Mr. Javed. He is asking, is it possible, how soon can he play after having a hip or hip replacement surgery?
Hip replacement surgery?
हाँ, transplant surgery, yes.
Sorry?
Hip and knee, yeah.
Hip or knee replacement.
Yes.
Right.
How soon he can play?
So if we talk about the hip replacement surgery, so once the hip is replaced, as we very frequently do, in that situation we ask people, जंपिंग का खेल मना करते हैं, जिसपे कूदने का बहुत फास्ट है वो मना करते हैं. लिमिटेड एक्टिविटी वाली खेल जैसे आप घर में बिलियर्ड्स, स्नूकर, इस तरह के खेल या जिसमें जंपिंग कम से कम इन्वॉल्व हो रहा है वो खेल कर सकते हैं. जैसे आप स्विमिंग कर सकते हैं, प्रॉपर साइकिलिंग कर सकते हैं, ये सारी चीजें कर सकते हैं.
Okay, and sir, there is one more question from Mr. Ankur. He is saying that they play badminton occasionally, and while playing, they have a discomfort in right knee sometimes. So, what is to be done?
So, if there is pain in the right knee, we have to see that in which area is the knee pain they have. So, अगर नॉर्मल सा पेन है, तो I would suggest कि नी कैप पहन कर खेलें. नी बाइंडर आता है, वो नी कैप पहन के खेलें. पेन हो तो आइस की सिकाई दिन भर में 3 से 4 बार करें. क्वाड्रिसेप्स हैमस्ट्रिंग की स्ट्रेंथनिंग एक्सरसाइज करें. बिफोर बैडमिंटन खेलने के पहले वार्म अप करें एंड देन स्ट्रेचिंग करें, फिर उसके बाद।
Okay, that's it, sir. Thank you so much, sir.